Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations. Clinics, hospitals, point of service, emergency departments, private offices, echovascular, general, high-risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today's guest is Dr. Ronald Gray. He is currently the program director for the Diagnostic Medical Sonography program at Pima Medical Institute. Previously, he worked for Honor Health for 20 years, with the last 4 years at the Sonoran Crossing Medical Center. At this facility, Dr. Gray was the lead ultrasound technologist and clinical instructor. This role helped to build a foundation for the new ultrasound department to grow with the Honor Health system. Dr. Gray is a current member of the Society of Diagnostic Medical Sonography, and 2017 was on the board of advisors for a Venous Access program at Gateway Community College. Dr. Gray earned a master's in business administration with an emphasis in health system management from Grand Canyon University, and finished his doctorate in business administration with an emphasis in management in July of 2024. Congratulations, Dr. Gray. Prior to the master's degree, Dr. Gray earned a bachelor's degree in kinesiology from Arizona State University in 2001, with 2 associate's degrees from Gateway Community College in 2004 and 2010. 2004 associates in nuclear medicine and 2010 associates in ultrasound. Dr. Gray in 2018 cross-trained in computed tomography, CT, and 2019 passed the board exam to be licensed in CT. The field of research that has pursued associates with the doctorate of business administration with an emphasis in management is related to the healthcare industry, specifically medical imaging. Dr. Gray used quantitative methods to explore the budget concerns and confidence level of practitioners' use of ultrasound equipment in the emergency room, with a concentration on examinations that can be performed outside of this setting, specifically urgent care, hopefully showing management teams in the field of medical imaging the need to provide better evaluation of exams that can be performed in the urgent care setting rather than sending the patient to the emergency room of a hospital. Dr. Gray's long-term professional goals are to attain an executive level position to manage a healthcare system as a CEO and attain a position as a professor at a university to teach online classes in the areas of business and healthcare. Please help me welcome Ronald Gray. Ronald, thank you for joining us today on the podcast. Our topic today is the importance of ultrasound in the medical field and how we can better this profession. Thanks for joining us. I appreciate it. So Ronald is a director of an ultrasound program and brings a lot of valuable information to us. And so tell us, what are your top 3 things of why ultrasound is important to the field and what makes it so important?
Well, first, I want to say thank you for me on the podcast. So the 3 things that make ultrasound so important, or at least stand out from other imaging areas, is we're the eyes for the doctor. So basically, if we don't see it, the doctor doesn't see it. Another important aspect of ultrasound is that it's very tech dependent. So once again, that falls back into if we don't see it, the doctor doesn't see it. And then the third thing is that the physicians rely on us so heavily in ultrasound, and the vast amount of information that we need to know and understand is quite extensive. And just from my own personal experience, I don't know that that I had emailed you regarding this, but I also do a nuclear medicine and CAT scan, and you have to know a lot for those, but ultrasound just takes you that one level higher because you're having to know so many things about so many body systems, and that we're required to take multiple board exams. So I mean, not only are we having to know the physics and how the machine actually works and produces those images, but we're also needed to know everything about adult anatomy and pediatric anatomy and gynecological anatomy and baby anatomy and all the vascular system of our entire body. And I don't think people realize that when they're getting into ultrasound. And that's something that when we're doing interviews at my school or when I'm doing them, that's something that I point out to the students so they're prepared when they walk through the door. If they get accepted, that they understand that's your job and you need to make sure that you are doing your job to the best of your ability.
Yeah, I think that's not something that it's a hard thing to explain, right? And a hard thing to
Hmm.
people to really understand the full scope of the practice, if that makes sense, right?
Yeah.
I think to say, you're really acting like a physician to some
Yeah.
extent. And
On
so
some level.
to take that not so lightly, right?
Hmm.
I think it's a hard thing to convey to people. And some people, I think, take that on with a challenge, and other people kind of shy away from it, I think, a little bit. So, I agree. It's a hard thing to convince people of, but I almost kind of get resentful a little bit because it's like, wait a minute, you're paying us how much? And you want us to know
Right.
like, so take it as it may, right?
I will say though, the rewarding part of all of that is that even though there's that pay aspect, when you garner the respect and camaraderie with physicians, have that they're very smart people. They obviously went to medical school and have MD behind their name, and they value your opinion, your imaging, and you as the person to that same level. The pay is important, but that becomes so much more important because then they know that you're like one of their colleagues, so to speak, and
Right,
that when you give them information, because sometimes you have to before a rad can even read when you're coming
right,
to the ER,
right,
that they're like, okay, this person gave me accurate information. I know I'm waiting, but I have a plan for this patient to get them in and out of the ER just a little bit more quicker than I would normally if I didn't have that individual in my back pocket, so to speak.
right, right. I do think that is the beauty or the joy that I have, in working so closely with people, right? As a traveler, I haven't had that
Yeah.
recently, but in a department, you do get this trust level with a physician that the physician's like, oh yeah, she knows what she's doing. Yep, she knows this, she knows that, right? And can and really work as a team together instead
Yeah.
of against each other, right? So I think that's the beauty of ultrasound itself. So tell us what your thoughts are on point of care, the tool of point of care, because that as much as we say it takes a lot of years of experience and years of hands on the transducer to really get it and to understand it and to be able to be diagnostic. Now we're giving people who know nothing about ultrasound and ultrasound
Yeah.
and say, oh, well, it's easy. You can just do X, Y, and Z, right? And so, what are your thoughts on the point of care as a tool?
I think it's a very important tool. There's a couple of reasons. One of them, not to sound funny, but my dissertation that I wrote for my degree was focused on that. And through that research, which allowed me to better understand that a lot of people, like you said, go to like weekend conferences and then they have very little experience. They're not competent and then they go and use point of care. I think it's very important and it should be readily available for physicians to use. But I think that there needs to be more regulated, whether that's an internal item through a health network or a required competency-based test through like an ultrasound governing body. I know that the ARDMS has a point of care ultrasound type of certificate, but it's not, from what I've gathered when I researched it, it's not on the same level that you would need. Now, clearly, when you talk point of care, you're not doing diagnostic level medical imaging that goes to a rad. You're doing quick evaluation to see what's going on in the patient. And in my ideal world, it would be that once again, that aspect's very regulated, but the physician would understand how to use it and use it in a way to go, okay, I don't need to do an ultrasound on them. I don't need a CAT scan. I know what's wrong with them. We can move them out of the ER. There's nothing wrong with them. But if they have gallstones or there's some weird fluid down in the pelvis, they go, okay, I need to order that pelvic or that abdomen. Or you see some sort of hematoma in their groin. Okay, I need to order that vascular study for a pseudoaneurysm repair. It's more of a tool to allow them to better evaluate the patient rather than some people say taking away the ultrasound technologist job. But if it becomes more highly regulated, it's going to move to the point where they can make those decisions, and then you are ordering exams much more accurately, much more quickly. And when the individuals go and do those diagnostic tests, they kind of have an idea of what they're getting into before they get there, and everything just gets done that much more quickly, and it gets to the rad and the patient's out of the ER or into the hospital, depending on what their needs are. So I think it's a wonderful tool. Like I said, it just needs to be more highly regulated, and I don't know how to do that because each health network has different regulations. There's that certificate program through the ARDMS, and it's kind of a mishmash of things. So we as a community maybe need to start working on setting those standards to then better prepare everybody to understand what they're getting into when it comes to that aspect of ultrasound.
Yeah, it can be a catch-22, right? Two sides of the sword, right? Like, oh yeah, they have a blood clot in their common femoral, but we miss everything distal too, right?
Right.
What's the purpose for it? Is it to treat it? Then we need a formal ultrasound. Is it for admittance to the hospital? Then I think it's a valid tool. It's like, are we going to
Yeah.
or are we not? Well, let's look. Yep, we need to admit,
Yeah.
so I think, yeah, I think it can be a catch-22 a little bit. I know I've worked with plenty of residents and fellows, and they're constantly saying, "Oh, tell us more about ultrasound. Tell us more about ultrasound," and
Hmm.
happy to, but it's a need. It's definitely a need that even the residency programs need to kind of pick up on, and apply more, like you said, surveillance maybe is a good word.
Yeah, I think that's a really good word. It should be more of a surveillance tool because ultimately its purpose is not to take away jobs or
Right.
what we need as ultrasound techs in the hospital, not what we need, but our ability to do the exam and the understanding of what we do. It's to help reduce the needless exams that we do on some regard.
Be called in, right? Like if
Yeah,
you
yeah,
get out without us, then we don't get called in, right? So,
right.
so what was your published dissertation about then? What was the final outcome of your dissertation in regard to point of care?
So the title of it really quick was Formal Training Predicts Point of Care Ultrasound Innovation, Adoption, and Competency in Emergency Room Practitioners. And the crux of the study was that it basically showed, which is kind of an obvious thing, that when you're introduced to an innovation, that you are more likely to use it. Now, you also, because there's a theoretical foundation to it, there's a spectrum of people. And when you do that spectrum, you want to focus on the people that are going to go, oh, I use that modality or that imaging tool. So now I'm going to accept it at a higher rate. And then on the competency side, what it showed was basically that these individuals accept that new technology, but they're not very competent at using it at all. And it by calculation through statistical analysis, I was able to show that the more days that you use it, the better you do get, but there's no ultimate threshold of the amount of days that somebody would need. Like I wasn't able to figure out like the gold standard. I used my standard set of data, and then I calculated everything through a computer program that is used for statistical analysis. And then I was able to create what's called a slope. And then I input the information to the X and Y axis and used the amount of days that somebody would use the tool. 1, 2, 3 days is the furthest I went out. And you could just see the progression. But I'm sure if we calculated again and went out the 4, 5, 6 days, you'd be able to figure out the not gold standard, but the ideal amount of days where the competency and innovation adoption kind of become very similar and cross each other. So then that could be your ideal length of time for somebody being in a point of care ultrasound symposium or program
Ah,
is basically the conclusion that I came to with the study.
okay. So how long do you have your students in clinicals then? Is it based
And
off?
I'm glad you asked.
Yeah.
Yeah, because we're talking about these point of care symposiums that are only a couple days. Well, our students have to get 1,080 hours of clinicals, which is about 8 months of doing nothing but ultrasound.
Right.
and they're doing all the different exams that are required by the governing bodies that are over ultrasound, and they're doing them to get to the point where they're first year or new grad level ultrasound tech. And then as we all know, once you get done, your knowledge jumps by leaps and bounds in the first 3 years. And
Right.
by year 3, 4, and 5, you start to become much more familiar and comfortable with your job, where you're like, oh, I got this. I'm fine. I can figure it out.
Right.
But you don't realize, like, even introductory, you're like, oh my gosh, this seems overwhelming. And then you realize I'm not in school anymore. I have to do it all on my own. And that plays into the jumping and better understanding of what your job is overall. And it doesn't matter whether you go to a program that requires you to have another imaging modality before you get into the program, whether you're graduating with a bachelor's or just the associates, the students are all the same when they come out. That's the level they are at, and they all jump that high.
Yeah, I'm sorry, my phone is like cutting us in and out for some reason.
Oh, no worries.
Um, so yeah, that's the disconnect between point of care and then an ultrasound tech, right? Or
Yeah.
going for 8 months to do it all the time. And then you still need a few years after that, right? To really feel confident and understanding and technique, right? And
Yeah.
how to do that. So I think how would you improve the overall experience of a student to have more hands-on training? What are some of the things that you would emphasize in your program in order for the students to really, because I remember when I was in school and they'd say, jump in, go do it, don't just watch.
Yeah.
Wow. So, are there any particular trainings that you have for your clinical instructors or?
So, no. And the reason I say no is I don't know how it is in other states. I live in Arizona, and each healthcare institution has its own way of handling that aspect of a technologist job, meaning clinical instructor. So, a health network that I actually work for, I'm PRN for them. They have them go through like a class where it's like a staff member goes through and checks off all these items in a video format. It's Zoom, and I think they watch a video, and then they're checked off, and they're like, now you're a clinical instructor, and then you get the extra amount of money for whenever you have a student per hour.
So
But
out
what
of
we try to also do in my go ahead.
excuse me. So out of curiosity, can you share how much money that is for a clinical instructor?
Yeah. Is it okay if I mention the healthcare network that I?
Sure, sure.
So I work for Honor Health, and I'm PRN with them, and I actually worked with them for 20 years. So in that 20-year time frame, I was a clinical instructor for like the last 10. It was like $1.50 an hour. For every hour that you had a student. So if you didn't have a student on a Friday, then you weren't paid that extra $1.50.
Okay. Wow. That can get complicated to keep all that straight, I guess, right? But
I mean, yeah, no. It's when you have the computer program that does it for you, where you can just label,
yeah.
then you as the director or manager can figure out when the student was there. And if you have to add it, the student has logs, so you can go back and look at their logs. So
Okay.
it is simplified. I think if we didn't have the computer side of it, it would be much more complicated.
So about $1.50. So wow, that's interesting. Okay.
It used to be a bonus, honestly. Like every 3 months, you'd get $300 or $400 added to your check, whether you had a student or not. And I think that they saw that that was less valuable than offering the hourly wage. It probably costs more money if you did it over a year versus that bonus. But it's more of an incentive because I think that people weren't willing to be clinical instructors as readily because you're like, well, it's just a bonus of whatever that's taxed. So I'm not really getting that much
Right.
benefit. But if people look at it like you're teaching the future technologists, no matter the modality, and they're going to eventually take care of us, like it is worth it because you want to teach them correctly.
Right? I think that's a good frame of mind there to they'll be taking care of us, right? I
Yeah.
heard it talked about that way. But yeah, you're right. They're the ones who might be doing our ultrasounds in the future. So that's a good point of view.
Well, it's funny as I had that point of view a little bit, but then my wife drove it home. She does X-ray, CT, radiation therapy, and dosimetry. So she's like, awesome. She told me one day, she's like, I'm doing this because I want to make sure that when you and I are old, that they know what they're doing. I was like, such a good point.
Overachievers in that household there. That's amazing.
Yeah, she's amazing.
So, how would you try to elevate the ultrasound community with recognition or even elevate our clinical instructors or people who really kind of speak into our professional lives, almost like a mentor.
Yeah.
Yeah,
So
any
there's a couple of, yeah. So nurses have something called a Daisy Award, which is an amazing award for exceptional nursing. I think that Health Network, and maybe using my experiences as a school to help collaborate to create some sort of like radiology award. I mean, we could call it a Rankin Award or
yeah.
a piezoelectric award, something that's related to ultrasound or radiation that basically is the same concept, and that the individual is given some recognition, whether it's because they're an outstanding clinical instructor or they just did an outstanding job with a patient. To elevate things. I mean, I know that there's the great job little cards and people get gift cards, but the Daisy Award has so many more connotations to it where they get like a certificate and there's an award ceremony, and the health networks put things on social media. And I think that if radiology as a department was given those opportunities and they could pull from each one of the imaging modalities to pull out an exceptional individual, they went above and beyond. I'm one of the things too is I was thinking about this when we were talking about point of care, is that if there's an exceptional ultrasound tech that went out of their way to create like a program within the health network that elevated point of care, where it's taught by somebody who actually knows how to do ultrasound, not a physician that went to a symposium, or not nursing, not to demean either one of those positions because they're amazing, but they don't have that background and they're going off of what somebody taught them. And I feel like going through that is like listening to a telephone where you tell somebody at one end of the table, and by the time it gets to the other end, it's completely different and you're missing aspects of the story. So if we added all of those things together and put them in some sort of award or social media post for each network, and got with the different governing bodies, the ART, ARDMS, CNMT, MRIs, and had them promote things in different ways, it would elevate our medical imaging careers overall.
Yeah, I think there needs to be some kind of recognition, right? I think if you're able to attend an SDMS conference, there's plenty of time there where people are recognized for their work given to the community. And
Hmm.
I think that's amazing and awesome, but I don't know that we talk about it enough. I think
Yeah,
it's there and you notice it if you go, but you don't notice it if you're not there.
yeah,
And so, yeah, I just think it's definitely something needed. And it's a motivator, I think, for a lot of people, and not just for clinical instructors, but for anyone, right? So,
yeah. Well, I
so,
think also too, maybe if sorry, I didn't mean to cut you off.
oh, go ahead.
Um, I was also thinking if medical imaging as a community, we all got together and started becoming more involved in areas of the hospital. And what I mean by that is, before I left Honor Health as a full-time employee and went to, and if you're, is it okay if I say the name of my school?
Sure. Absolutely.
Before I went to go work for Pima Medical Institute at the Phoenix campus, I got involved in a process improvement project where I was actually selected out of different people that submitted their process improvements. I mean, there was multiple that got selected, but I got to discuss and speak about my dissertation and what it brought to at least the medical imaging side of things. And if people were involved in those types of things, that could help elevate the medical imaging department too. Because as far as I know, at least for mine, I don't know that anybody else in medical imaging had ever brought forth anything that was presented to a large group of individuals that were at higher levels than even like a manager. They were more like directors and directors of medical imaging and the hospitals and things like that. That brings more attention to not only you as a person, which is important, but the more important aspect is to your department, to your imaging modality. And I felt that by doing that, maybe I helped a little bit. And so if we as a community do the same thing, that could help as well.
Absolutely. Yes, I agree. So I'm going to take a little rabbit trail here because we talked about this point of care a little bit. And I
Yeah.
want your ideas on what would you include in a training for point of care? Because, there's a lot of different things that they scan. right? So do you want them,
Yeah.
because if it's used in the ER, they're checking for fluid around a baby, or they're checking, if they're using it in labor and delivery, they might do a Doppler, or if they're checking it in the ED, you might be doing a DVT or something. So what would be your basis of instruction there?
It's funny that you ask because I at one point was doing something like this for one of a different school altogether, but for respiratory therapists because they put in IVs. So one of the things I would include is obviously not a down like intricate physics evaluation, but I would at least let them understand like the concept. You need like a curvilinear if you're going to look at somebody's abdomen. If you're going to look at a blood vessel in an extremity, you need a linear transducer because usually those are the only two transducers they have.
Right.
So if it falls in those categories, you have to know you've got to pick one, and then they would need to be shown how to adjust the frequency to get a better image. That'd be like the first topic I would go over. And then secondarily, I would start going over where you would look for organ systems, making it very basic. You're going to look at the liver. You can look at the liver through the side of the body. You're going to look for the pancreas in the middle of the body. Like, obviously, don't break it down to where it's kindergarten level, but
Right.
a level that makes sense for your group of individuals that you're talking to. And then break down like things that they know that are common, like gallstones, pancreatic pseudocysts. You would know what a DVT looks like, whether it's in the arm or the leg, what a hematoma looks like, because you get a lot of people that get those cardiac catheterization and their leg is completely bruised. Being able to identify potentially like where a nerve is. I know that that's a little smaller and more narrowed, but I think it's important because it can be confused as a DVT specifically in the arm because that brachial artery really shows up well. So it would just be very basic categories that I would go over. So then that way they would understand, okay, this is what I really need to know. And these are the things that are going to help me decide whether or not I need that diagnostic ultrasound or not.
Yeah. Yeah. And the simple rules of 90 degrees versus at an angle and different things
Yeah.
too, right? So yeah, it's hard to like bring it all down to just a little piece of information for point of care, but yeah, it's definitely needed.
Mm-hmm.
Definitely a place of need, that's for sure. Well, thank you so much for your time and for your expertise on all these and for your contribution to our ultrasound society. I certainly appreciated talking to you and sharing with us all what you do.
Thank you. Thank you for having me on the podcast. And thank you for all that you do. If there weren't podcasters such as yourself, we would have less of a voice in the community. So I appreciate all that you do as well.
Oh, thank you. Yeah, I hope this will help bring us all together. And when we talk about needs, then maybe somebody will get a wild hair and decide to want to do it, right? So,
Yeah.
I think these are great ideas to talk about. And hopefully we get more recognition and we can talk about it more. And maybe I'll talk about it more on the podcast of different SDMS recognition, different things like that. So,
Yeah.
that'll be good. Thank you so much. I appreciate it.
You're so very welcome. You have a wonderful day.
Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.